Hi there, this is Dr. Mark Donaldson, welcoming you back again to the second part of our series looking at an evidence-based challenge, managing dental patients on anticoagulants. In the second part, we look at the science of clotting. So what is the clinician's view of hemostasis? As a quick review, if we go below the gum line, we do some type of dental surgery causing tissue injury. The body responds by activating platelets, which travel to that area to cause healing or the platelet plug in that area. The platelets release what are known as chemotactic factors, and that activates what's known as the coagulation cascade. As a quick review, we have a number of factors involved in the clotting cascade, and these are the sites at which our anticoagulants will activate. Ultimately, the body forms a clot over time, and almost in reverse, the clot, as the tissue underneath heals, is broken down by different factors, and that tissue injury ultimately results in healed tissue. Perhaps a simplified version of hemostasis is again recognize that we have initial tissue injury. The body's natural response is this platelet plug, which is why patients, even if they are on oral anticoagulants, still get good hemostasis postoperatively. This platelet plug is the level at which antiplatelets function, our aspirin, our clopidogrels, also known as Plavix, and not at the next level, which is reorganization or stabilization of the platelet plug. This is the area at which our anticoagulants, Coumadin, warfarin, tend to work, ultimately resulting in either good clotting or poor clotting and a poor hemostatic outcome. So the questions we probably ask every time we see a patient on an anticoagulant in our office is, can dental treatment be performed on patients taking these medications? Should patients discontinue these medications prior to treatment, and if so, when do we reinitiate therapy? Are there appropriate laboratory values to assess the patients for dental treatment? And lastly, are there additional drug, diet, or even laboratory interactions that need to be concerned about? If we were to design the ideal anticoagulant, it would have rapid onset as well as rapid offset so that we truly could organize the administration of these medications around the time we perform dental surgery. Since oral dosing is always preferred in our patients, oral once daily fixed dosing, in other words, the same dose in all patients, would be ideal. If there were minimal food and drug interactions and a predictable anticoagulant response, all of these would again be characteristics of the ideal anticoagulant. And lastly, if everything went to worms, if there was a specific antidote, that would be ideal. Our current anticoagulants still do not fit all of those ideal characteristics. For greater than 50 years, we've been using an anticoagulant known as warfarin, also called Coumadin. Coumadin inhibits the vitamin K-dependent clotting factors. Again, referring to our clotting cascade, you can see that those vitamin K-dependent clotting factors are factors 2, 7, 9, and 10. Due to this non-specific action of Coumadin or warfarin, we need to watch the efficacy or toxicity of this drug very closely, and that is done by constant blood monitoring of the international normalized ratio. If patients do not have a recent INR in order for us to determine what their anticoagulation status is, a very simple point-of-care test can be done at chairside, simply taking a drop of blood either from the patient's mouth and applying that to a test strip that plugs into a point-of-care machine such as Roche's Coagucheck. Ultimately, will give you a very accurate INR within 30 seconds. This technology is very similar to the same type of point-of-care machines that diabetics utilize every day, taking a drop of blood, putting it onto a test strip, putting it into the glucometer, and again within 30 seconds getting a very accurate blood glucose reading. The other challenge with warfarin, of course, is that there are lots of drug, diet, and laboratory interactions. Thank you again for your time today.